A cholera outbreak ravaging Yemen, and it's spreading in an unprecedented manner, says the World Health Organization. It's calling for emergency assistance to help stop the spread of the disease. There are almost 40,000 suspected cases in the war-torn country where the healthcare system is collapsing. The epidemic has killed nearly 500 people since late April. For more, I'm now joined by Tarik Jasarevic. He's a spokesman for the World Health Organization. So good to speak to you. We know that cholera is actually curable. So why are people dying in Yemen?
Well, as you have said, the health system in Yemen is on the brink of collapse. Health workers have not received salaries for 8 months. Many health facilities are not functioning or are functioning only partially. And in many areas, because of the security, people cannot reach functioning health systems, which means that the numbers that you have just said, about 500 people who died only in the last 4 weeks, is probably bigger. In addition, there is rains that are coming down in some parts of Yemen right now, and another problem is the garbage. Garbage has not been collected and handled, which means that there is a really problem of clean water, and clean water is the key to fight cholera.
And as you said, clean water, as you mentioned, so is it how people get infected in the first place, is water?
Well, exactly. The bacteria that is causing cholera is being transmitted through unclean water, and this is really a big issue right now in Yemen. It is curable, as you have said, and the World Health Organization with partners is trying to put in place as many cholera treatment centers as possible. We had 40 set up so far, in addition to temporary rehydration centers where people with a mild and moderate cholera symptoms can get hydrated and in that way stop losing water. But again, we are underfunded. Only 17% on what has been asked to respond to this outbreak has been received so far. So the situation is very alarming, and we are trying as much as we can to try to help health authorities across the country.
And World Health Organization asked for emergency assistance. So what kind of assistance do you actually need, and which organizations are helping enough?
Well, we managed, for example, last week to bring 67 tons of cholera equipment and cholera medicines, and it was the first time that we were able to charter a flight that landed in Sana'a. As you know, Sana'a airport is virtually closed. We also managed to help to set up a cholera treatment center. But as I said again, in a country where health system is not working, where people cannot access health centers because of the security, in a country where many districts are now without doctors, it is really difficult to reach everyone.
And how many people were cured? Also, how many are sick right now, and what needs to be done to stop the spreading of it?
Well, again, so since late April, so in the last 4 weeks, there were more than 55,000 reported cases of acute watery diarrhea or suspect cholera cases. And as you have said, 1% of them, more than 500 people, died. What is really important is that first people get access to clean water, but also that if they have symptoms, that they can really reach these rehydration centers or health facilities where they can get oral rehydration salt, which is really the basic treatment that helps people compensate the loss of water through diarrhea.
Thank you very much for joining us here on TRT World, Tarik Jasarevic from the World Health Organization there.